Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about cervical cerclage. What is cervical cerclage? Cervical cerclage is the surgical procedure that is performed to stitch up the mouth of the cervix of the uterus during pregnancy to prevent miscarriage or preterm birth. This procedure is usually done between 14 to 20 weeks of pregnancy. Who are the candidates of cervical cerclage? Women with a history of premature birth, women with short cervix or women with incompetent cervix, women with cervical surgery prior to pregnancy. Before the procedure is done, doctor will examine and he will recommend cervical cerclage if the patient is the candidate for cervical cerclage. What is the preparation prior to cervical cerclage? Doctor will do ultrasound to check the health and the growth of the baby. Infection screening will be done, and if the patient has got any infection, antibiotics will be given to treat infection, and the patient will be expected to finish the course and until the infection is cleared, and that is the only time that the procedure will be performed. Cervical cerclage will be done in operating theater. Therefore, the patient will be admitted in the hospital. In the ward, before surgery, the patient will be prepared for surgery just like any patient that is going for the procedure, and the patient will be taken into operating theater for the procedure. The procedure, cervical cerclage, can be done under local anesthesia, for example, epidural, or it can be done under general anesthesia. It depends on the anesthetist recommendation, and it also depends on the patient's condition. The procedure itself can be done vaginally, which is transvaginal, or the procedure can be done through the abdomen, and it all depends on the surgeon's recommendation. Once the procedure is done, the patient will be taken to recovery room. From recovery room, the patient will be taken back into the ward. And some patient can be discharged on the same day, and some patient can be kept overnight. It all depends on the doctor's recommendation, and it also depends on the patient's condition. What to expect post-cervical cerclage? Patient will be encouraged to take enough rest. Patient will be advised to report any abnormalities, even if the patient is at home, so that those problems will be attended to. It is very important for the patient to know about the procedure so that he will know when to report if there is any problem. When is the cervical stitch is removed? Cervical stitch is removed when the patient is at full term. It can be 37 weeks to 40 weeks. The stitch can be removed electively at any time. At that time, the labor can start. Or even if the patient is at term and the patient is starting to feel mild labor pains, the stitch will be removed and the labor will allow, because this stitch is on the cervix. Before the patient delivers normally, the cervix needs to dilate. In case of emergency, or in case if the patient needs an emergency cesarean section, the patient will be taken to theater and cesarean section will be performed at the end of the procedure and the cervical stitch can be removed. What is important here, or the message about cervical cerclage? If a pregnant mother discovered that is important, it is important for that mother to start visiting prenatal clinic early, because if you don't do that, you may not know that you are having this problem like short cervix, and you'll discover that you are having miscarriages because you were not aware. The message: please start your pre-antenatal clinic early so that you will discover, or the doctor will help you discover any complications that may be associated with your early pregnancy. It is important to follow up even if you do have a stitch inserted, and make sure that towards the end we all having a healthy mother and the healthy baby. That's the most important thing. If you are pregnant, healthy mother and the healthy baby is our best results that we are looking for. For today, I will end up here. If you do like these short videos, please subscribe, please share and comment. Thank you for watching. Thank you for support. Till next time, stay safe and be healthy.